Well, hello everyone. This is Jordan Engel at MEF Associates. I'm very pleased to welcome you to a conversation on engaging people with lived experience with human services programs. Thank you for joining us for this last session of the 2022 NAWRS virtual series. NAWRS, or the National Association for Welfare Research and Statistics, holds in-person conferences every other year where human services researchers, practitioners, and policymakers come together to talk about their work and how it can inform policy and practice. NAWRS holds virtual events in years when the conference isn't occurring. These events present an opportunity to keep the NAWRS community engaged and to highlight interesting research and trends relevant to our membership. This is the last session in the 2022 virtual series. Previous sessions we hosted in 2022 include bringing long-term stability to the child care market, effective workforce and subsidy policy strategies, and addressing substance use disorder in the human services context, cross-system perspectives. Recordings of those webinars are found on our YouTube page and are linked on the NAWRS website. Today's webinar will also be recorded and posted on our website and YouTube page. And I'll also highlight that the website has a list of resources related to today's webinar, some of which will be discussed by our panelists. People with lived experience provide so much valuable insight to agencies about how they serve, how people interact with their programs, why people may choose not to interact with programs, and how to improve programs to better serve their communities. I'm so glad that the field of policymakers, practitioners, and researchers are increasingly recognizing this value and are making efforts to authentically engage with and listen to people with lived experience. I'm excited to see such a large audience today, which again shows how invested the field is in engaging people with lived experience. Before turning things over to the panel, there are a few quick thank yous I want to extend. I want to thank the co-chairs of the virtual workshop, Asaf Glosser at MEF Associates and Lauren Antella at ACF. Lauren has been instrumental in making this event come together. I also want to thank Jamie Haskell on the NAWRS board for his support in disseminating information about this webinar and the other virtual events. And finally, a particular thank you to the panelists. I'm so grateful for everyone's time and efforts to join this conversation. To Chelsea, Melissa, and Laura, thank you so much for being here and engaging in meaningful conversation, especially at such a busy time with the new federal year. To Lisa and Bright, thank you for your thoughtfulness around this panel and your commitment to authentically engaging people with lived experience. And most importantly, a huge thank you to Samantha and Roger. Your voice and candor provide so much insight to the organizations you engage with on a regular basis and have been so invaluable to today's conversation. I can't wait for everyone in the audience to hear you speak about your experience. With that, I'll pass it off to Lisa to formally introduce the panelists in today's conversation.
Thank you so much, Jordan. Hello, my name is Lisa Shelby, and I'm an associate professor at Florida State University College of Social Work. It is truly an honor to welcome you and to serve as a moderator with Laura Erickson for today's conversation. Thank you for joining us. We are here to talk about engaging people with lived experience in the design, implementation, and evaluation of social programs. In preparation for today's conversation, the members of the panel have met virtually a couple of times over the last several weeks. What became apparent to all of us is that we each bring different perspectives. For example, various panelists had different thoughts about terms such as lived expert and lived expertise and lived experience. We talked about the importance of language and being intentional. A big take-home point for me from the discussions was the need for dialogue, and that's what we bring today. Today is about a conversation among people with lived experience and those committed to engaging people with lived experience in various ways. We develop questions that we think are important to explore, and we welcome you to add to our discussion by raising questions in the chat. Before we start our conversation, I want to have all of the panelists introduce themselves. You will get to know the panelists and their backgrounds throughout the conversation, but we want everyone to share their name and where they're from before we get started. And to make it easy, I'll call on people. Chelsea?
Hello, everyone. My name is Chelsea Hall. I use pronouns she, her, hers, and I am the current Director of Family and Community Engagement at the Colorado Department of Human Services. and honored to facilitate our Family Voice Council here in Colorado. Thank you, Lisa.
Thank you. Samantha?
Good afternoon. I'm Samantha Fields. I'm from Colorado Springs, Colorado, and I am a member of the Family Voice Council in Colorado with the CDHS, and I'm happy to be here today.
Thank you. Roger?
Good afternoon, everybody. My name is Roger De Leon, and I'm a parent partner with Children's Services out here in Riverside County, California. I'm a father with lived experience.
Bright?
Hello, everyone. My name is Bright Sarfo. I am a senior research associate at MEF Associates, and I am from PG County, Maryland, and I am so excited about the conversation today.
Awesome. Melissa?
Hi, everyone. Melissa Lamberdowski. I'm with the ACF's Office of Early Childhood Development, Deputy Director there, and very excited just to support all the work that's going on. Thanks.
And last but not least, Laura?
My name is Laura Erickson. My pronouns are she, her, hers, and I'm a social science analyst in the U.S. Department of Health and Human Services in our Office of the Assistant Secretary for Research and Evaluation. And it's just an honor to be here with you all today.
Great. So I think with all of the introductions out of the way, we're ready to start the conversation. And I'd like to start with a question to our panelists with lived experience in social programs. So Roger and Samantha, can you share what has it been like to share your experiences with agencies you've engaged with?
So I can go ahead and go first. So what it's been like is I would call it a dream I've never had. And the reason behind that was because of my experience. It wasn't the greatest. And just to share that I'm not here on any type of revenge. Right, as a father who had navigated the child welfare system, it wasn't the greatest feeling in the world. Not to mention the treatment that had come out of it, but the benefit of being able to come in and help develop this program, the Parent Partner Program, from the ground up, by sharing my lived experience, has been very beneficial to those that I serve within Riverside County Children's Services, but also with the department's blessing to be able to go outside and work with county, state, and even federal. And so for myself, it's been an experience that I've been able to give so that others who will come behind me, other parents who come behind me, may have that opportunity to be able to, get a better chance at certain things. So I've seen a lot of change and transformation. I'm also one who works with fathers and father coalitions. And so as we're working hard to bring that engagement piece and that awareness piece, we've also seen some wonderful change and seen some outcomes with parents and their families. And so for myself, this has been something that I've been able to be a part of and witness, and also be motivated by to continue going forward. And so I've had two wonderful individuals who are here with me today, or here with us today, who I have the privilege of also working with. And so that's my adventure.
My adventure with lived experience started in 2011, but I honestly didn't know that's what I was doing. I was just sharing my experiences and didn't know that anybody really cared about it. But in 2019, I started working with the state of Colorado on a member experience advisory council, and then now with the Family Voice Council. When I first started, I was scared. I didn't think I had anything to offer. I didn't think I would be listened to. And I learned quickly that I was wrong about that. We had great facilitators in our meetings who made us feel safe and respected and valued. And the value didn't just come from being compensated. The value came from, now I've been doing this for 3 years, and I'm asked all the time to continue doing this work and to share my experience. That really makes me feel good. A lot of the time, though, I'm very frustrated because change is slow. And there are still things after all this time that are still a mystery to me. I don't know how they work, but I'm inching along and learning how these things work. And it's just such a joy for me. I have been home the entire pandemic, so 3 years now. And if I did not have this work to do and this opportunity to connect and engage with people and have this purpose and meaning in my life, it would have been a totally different pandemic for me. I would have been completely isolated and probably would have been very depressed. But I'm busy every day. I have friends now, and I know that my experiences matter and they make a difference. And during all those frustrating times, I remember that the first time that we looked at a letter that we had given input on, and they actually took our input and changed the letter of correspondence. That was huge. I got to see that not only was I giving input, but the input of all the people on the councils was being listened to, and change was happening because of that. That's what keeps me coming back. That will get me through all the frustrations, is just knowing that we are making a difference and we are changing people's lives.
So maybe that sets really the groundwork for one of my next questions, the talking about the change that can come from this. But why else should we be committed to engaging people in our work? And whoever wishes to speak can absolutely unmute themselves.
Well, I think that being able to be open with individuals with lived experience is something that's very valuable. And I see that it's really taking a toll on a lot of different agencies. Being able to be a part of different councils, I'm not going to sit here and name all the things that I've been back and forth with, right? Because that we'd be here pretty much a long time. But just the privilege of being able to see that that when you're working with individuals with lived experience, and they're on the ground, right? Myself, not just have lived it, but also helping other parents navigating the child welfare system, navigating child welfare, child support, family law, and all these different agencies, and getting to have those opportunities that really hear what's going on. I know that a lot of policies have been brought out, projects, different wonderful trainings, but I think the missing component was that lived experience voice. To be able to advocate, and not just my voice, but the voices of those who I sit in the trenches with. We call them the trenches because it's on the ground, right? Being able to be with them, walk with them, hear them, feel them, right? Because this is we're talking about human beings here, and so I think that the importance of what's being now sought after with people with lived experience is that you're going to get what's actually happening out there, right? And this is for diverse agencies. It's depending on what you're looking for. When you bring in someone who has a lived experience and who's able to share in such a way, it brings that authenticness, that genuineness of the voice of the communities that are out there, especially when you come across parent leaders with those lived experience who have that trust. You're going to get a lot more information. We've seen that take place on a lot of different levels within the county, within the state, and even with our federal partners. We call a parent federal think tank. And so we're able to connect as parents with our federal partners and have these conversations, genuine conversations, where we're able to share, not to mention a couple other agencies and other opportunities to where we're able to give some information, but we're also able to receive some information. I think it's important for us, as parents, with lived experience, to be able to understand and know how the federal government works and how what are the guidelines and why things aren't happening the way that we feel should, or the timing on it. And so I know that I've had a lot of conversations with diverse individuals, with HHS, with ACF, and so all these different agencies, and really I've learned a lot. And so this is where we're able to connect, collaborate, and be able to develop these opportunities, but also at the same time to be respected in such a way that when I'm sharing, or when someone with lived experience is sharing, that there's the ears that are hearing and understanding to be able to bring change the way that we all really want to have it. It becomes more genuine. And so I think this is my reasoning behind what I do, is that if I can give my 2 cents in and at the same time receive something in return, I think we're getting somewhere and developing as we go forward. And so it also becomes really intimate when we're talking about individuals in the community. There's a lot of mistrust, distrust, And so I think this is another way of also developing that collaboration within that as well. And then, of course, receiving more and more trust to be able to share more information. So that way we get it right. Right. And so I'll stop right there.
Excellent. And you've touched on a lot of points. And I know that from the comments that there's some interest in like talking about some of the nuts and bolts. So we're going to get to some of those questions about how to make sure that we get authentic voice and other things. But Chelsea, I see that you unmuted.
Yeah, I know so many points from what Roger picked up, but authentic engagement is so vital, and the trust building is really at the crux, I think, of all of this. And I was just at a meeting last week, and someone said, and this is so very true, but like our families are usually the closest to the problem, as well as being closest to the solution, but furthest away from the resources and the power to make change. And I think that at CDHS is what we're trying to do. We're trying to shift the power. We're bringing families to the table and really seeing a culture shift at a state agency that's more less about taking that next step without family engagement. We have built it into our systems to say, before you pass this rule, have you talked to Family Voice Council? And that's just one, or on our onboarding, once family or people come on board with the Department of Human Services, have you been to a Family Voice Council meeting yet? Building that into onboarding practices as well is one thing and one way that we've helped change culture at CDHS. And then lastly, I think families should have a say now. We're at a very critical time to make change. And if families don't have a say now in how we build and rebuild our systems, then disparities will continue to grow. So I just want to make sure that we are involving those closest to the problems with the solutions so that we can decrease our disparities.
Yeah, I think there should be a commitment to this work, because all of these programs and services, they impact my everyday life. But they're not just services to me. They're what determine my quality of life. If I can't take advantage of these services, if I can't give my voice to say how they should work, then they're not helping. We want them to help. And that's my reason for being in this, is there are changes that have to be made, but if we're not hearing from the people who they affect, you're not going to be able to make the change, because you're just not going to know.
Yeah, I will just add, I completely agree with all those. I mean, it's basically the right thing to do, especially with government funding, that it should be informed by parents and families with lived experience. I'll just add a couple of things, which is exciting about the time we're in right now with leadership, because there has been directives from the government and the president. And I think you've probably all heard about the executive orders on advancing racial equity and support, but there's also a newer one. And I know Laura from ASBE can say more too, but there's really a push on transforming federal customer experience and service delivery. So we're all really taking that to heart across government. And I know at ECD, we've been working on our own action plans. That's really part of these great conversations we've been able to have with the think tank to give feedback. There's it's a work in progress, I will say. There's definitely sort of challenges and opportunities all along the way, but it's been just incredibly valuable and learning, I think, from both sides. So just say that.
Yeah, I would totally echo that, Melissa. And I think the other thing that comes to mind in terms of leadership priorities right now from a federal level, at least, is just a really big emphasis on the importance of equity when we're thinking about engaging people with lived experience. And I know many of us at a federal level have been grappling with, the historical harms that our systems have caused. And so I think that's been a big piece of this for me, at least, as it's really important to engage people, not only to make sure that our programs can better serve the people that we're trying to reach, but also to make sure that we're addressing some of the historical harms that we've caused at a federal level. So that really is another thing that jumps out to me.
And I'll just echo everything folks have shared. I 100% agree with. I think these were great points. And I'll just acknowledge that for folks who are delivering services, for folks who are running organizations, if you go to an organizational website, you'll see all of these incredible missions about empowering, about supporting, about assisting communities in need. You'll hear all of these words, but program directors, administrators, case managers, they have a lot to do on a day-to-day basis, and there are other interests outside of that mission that impact them day to day, right? There are grant limitations. They have to answer to federal project officers. They have to meet numbers. They have to input data. They have to do all of this work in order to sustain their programs. And I think oftentimes that mission becomes more and more blurred because we have to get this work done. Working with folks who have lived experience, and I'm not just talking about folks who've been with your program for years and years and know it in and out. Yes, they can tell you a lot about your program, but even the person who came in the door day one and has no idea what this program is offering, they could give you a wealth of information about how your program looks to someone who is unfamiliar with them, who is unfamiliar of this world that has actually funded this program and drives it. And so it is essential. They're like folks with lived experience. Not only is it about really inviting them to the conversation about how these programs are built and how they function, but it is essential to making sure that these programs, these agencies don't lose sight of their mission. And if they're falling short for the people that they are supposed to be assisting, the folks who actually get those services are the voices that will tell them that. And it's really essential that they continue to be part of those conversations.
So how do we do this? So let's talk about like specific strategies. How do we make sure that we are actually engaging in authentic conversations with people and to the point, not people that have been engaged in services for an extended period of time, but people who may be walking through the door, or even those who may be eligible that we actually aren't in contact with. So how do we do this? What are some pieces of advice?
So I would add that when you're looking to have a conversation, right, especially with someone with lived experience, I know that I can share that to be intentional, right? To be open and genuine. And basically the way that we put it, be real. I know there's a quote that's out there that got me one day. And so I'll throw it out there as well. Nothing for us without us. That is the voice of lived experience, that nothing should be created for us without us. Because just as was shared earlier, that we're the closest to the problem, but we're also closest to the solution, especially those of us who have found a way to get through what it is that we've gotten through and been able to take it out and help others, right? Like myself with child welfare, I relive my trauma every day, but I relive it differently now. Now I'm able to give the opportunity to other parents to be able to help them, guide them. But at the same time, I'm learning. Just because I have lived experience does not mean that I know everything. And so when you have that type of, the type of individual in front of you who's willing and able to have that feedback, the one thing I would throw out there, which, I can share, Melissa as well as Laura did, was when you have a phone call, whatever, begin by listening. Begin by listening, and it's okay to throw out a subject. It's okay to throw out what is the intention of everything, but begin by listening, because having certain questions and then laying back, you're going to learn a lot. I, to this day, learn a lot from others who are navigating these systems. And so it's important because when you sit back and you learn to listen, you actually can get information and even answers even before you even ask a question. Sometimes a lot of questions are answered just through conversation when there's a genuine openness and just that reflective listening. And so my thing would be that, depending on what it is that you're looking for, as I always share, be intentional what you're looking for to the best of your ability, but don't go in there stating this is what's going to happen. I shared this the other day. If you're going to ask somebody with lived experience, especially if they're raw and uncut and they're on the ground, what it is that's going good and what's not going good, be prepared for the answer that's going to come. And especially if you're telling them to be real, they're going to come and they're going to be very real. And it may not come off the right way, but remember this, we don't take things personal. For the simple fact is, depending on how things are flowing, there has to be that openness to be able to receive it, right? I have a quote, quick to listen, slow to speak, and slow to be angered. When you're quick to listen, even when somebody's elevating, they have a passion that's coming out of them. because they want to be heard. And so when you're quick to listen, you're gathering the information that you're looking for. Sometimes you don't even have to ask a question about it. Just bring up a subject and what it is. Slow to speak is being careful on the response, because some responses can shut down individuals. It's like, nope, you're just like everyone else. All you want is something from me. And this is why I don't talk to you people. Now, no disrespect, but that's what's going to come. And slow to be angered, because once you're upset and you take it personal, nobody's listening to anybody and nothing's going to get done. So that's one thing that I would throw out there, in the importance of really paying attention and listening when you're being intentional, bringing up a subject on it and allowing them to speak to you and share with you certain things, and then go from there. But just like I said, nothing for us without us.
Yeah, Roger, thank you so much for bringing that very well-known saying to us, and then also the active listening part. I remember when I first started and they told me that Family Voice Council was going to be my role to facilitate, I was nervous as well. And I knew the first thing that I needed to do was go have one-on-ones with families, go to them. Whenever I meet someone, a new community organization, a different part of the state, or a new Family Voice Council member that's interested, I go to them and I have coffee or tea or wherever, and somewhere that's comfortable with them, and I meet with them one-on-one. I was also in a community in Eagle County who has a very large Hispanic Latino population, and they had a full-on Spanish conference for mental health, or a focus group rather, and the facilitators walked in, and one was a male, identified as male, and said, "Where are all the men? Where are all the fathers at?" And the women said, "Well, you silly man, you didn't invite them." So that was one thing, is like, really, who's setting the table? Who's doing the inviting? And I think early on at Family Voice Council, we had a parent leader who was doing the inviting. We had a few parents who were building and setting the table for other parents. It wasn't me, it was them. And I think one thing that we do now to this day is, if someone's interested in joining the Family Voice Council, we invite them to a meeting. They can participate as much as they'd like. They could sit back, relax, and just listen. But then they get firsthand experience of what it's like. And then always, 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 they're like, absolutely, I'm ready to join. So give them that experience up front.
I'm curious if anyone wants to speak to the like how this happens in the research space. I'm seeing a couple questions coming in the Q&A about how do we, do this meaningfully and authentically in the research space, and whether there's any kind of research basis for this. I'm curious if anyone wants to jump in on that.
Sure, I could say a little something. I think in the research space, there's a number of different ways to engage folks with lived experience, but also I think you have to be really clear about what your reasoning is for engaging people with lived experience, and what exactly you're looking for from people, because I'm leading a study right now that is looking at improving the way healthy marriage and responsible fatherhood programs serve Black communities, Black clients, couples, and youth. And so one of the things we're doing for that is actually having this work group that is regular, that we're meeting with regularly, and the very purpose of that group, and we're not treating them as participants. They are consultants, and they are consultant partners in this project. And so their role and function is to provide another perspective in the kinds of data that we're seeing. They are providing feedback in the kinds of tools that we're using to collect data. They are engaging in conversations about how we make this study work, and what some of our assumptions are of the communities that we are trying to get data from, and whether that's actually right. And part of this on this panel we have experts, but we also have people who've actually participated in these programs that will be able to look at this and say, and let us know if we need to pivot in terms of where our study is going, or or whether we're on the right track or not. And one of the things that is really pertinent is being very transparent about what you're trying to get from them, being very transparent. And also, when it comes to being a researcher, I'm telling you right now, there's language that we use, there are the way we write our documents, the way we write our emails, like we are in our own cultural bubble. And so many times I find myself actually engaging with these expert work group members, really having these one-on-one conversations about, hey, this is what we're planning to do, letting them know what exactly they're being asked to do when they come on these calls, and just being transparent and not sort of hiding what you're trying to get from folks. And so that's been very useful, but it's also a learning opportunity. They can tell us we're going in the wrong direction, and we have to be ready to hear that.
I heard two things real quickly that really resonated with me. And that one is about the father inclusion. Working with the government agencies, and we talk about parents, doesn't necessarily mean mom and dad. There's father coalitions across the nation for a reason, and that's because father inclusion is now looked at as, okay, we need to do this. We need to be very real about bringing both parents to the table. And the other thing I heard was going into the community. Absolutely. Trying to bring, if we're looking at genuine information, depending on what you're looking for, you want to meet them you want to meet families where they're at. You want to go into their area. You want to be able to go and speak in their community. A lot of times, and this has been shared, from what I've heard as well, is when we're looking for individuals with lived experience to come in and to come into our world, what happens is that we get individuals who are not so much all the way down in the trenches, or who can be lost in working in, the agencies. It's really depend. Like I said, if you really want genuine information about a community, it's meeting them in that community and then building that rapport, right? And so I bring that out because I know a lot of times, this is what's been thrown out there. Well, where are the fathers? Where are the men? And the invitation is not there, or the invitation is there, but it's not looked at that way. Or the simple fact is that, a lot of times, and there's statistics on this, where a father doesn't feel like he's welcome in to any type of government agency because that's the way that it was built. And so I would throw those out there to be intentional with those, and also intentional on going out, especially with someone who has a reputation in the community, to be able to get that information. Because I'll tell you right now, a lot of the beginning is going to have to be rapport building, especially if you really want that true, genuine relationship and our information, should I say, and whatever it is that you're looking for. And so I do that. I do a lot of that public speaking whenever we're doing anything, because child welfare is involved, of course, right away. Any parent's like, nope, I don't want nothing. DPSS, I don't want nothing, right? And so we have to be very strategic on that. Not that we're trying to fool anyone, but as soon as we're there, being open and transparent, as Bright shared, is vital. Being able to share exactly what it is that you're looking for, being able to share even how long it's going to take and how things are going to take some time. We know how our government agencies work, right? I work with child welfare, been doing it for 7 years. We call it county time. So we know that it takes its time. But see, there are parents who are out in the community who don't know that. And they assume that, okay, will you come talk to me? Well, it's been a couple of months. I haven't heard nothing from you. So all you wanted was to use me. And that's not the case. But there has to be that explanation and that follow up and follow through with all of that. So I would throw that as well out there.
I participate a lot in research studies. I'm a data geek. I love surveys. I just love doing that stuff. So I'm okay if I'm just giving my information and I know what they're going to do with it, but I'm not that involved. But more now I'm seeing that companies are making sure that I know what's going to happen, what I'm going to get out of this, what value there's going to be to me for giving my information. Because I'm not research, I'm not a statistic. I'm a valuable member of the community, and I have my experience to offer. And if they want it, then they need to be able to give me something in the end. What is going to happen with this information? I want to know that, even if it doesn't directly impact me, I just want to see what came out of it. And a lot more, I'm seeing that they're doing that kind of thing with the research.
And in addition, I would say to Samantha that not only is she like a participant in the research, but now we're seeing, for example, we had our TANF data experts and researchers come to Family Voice Council from the very beginning and get family input on the process and the procedure before they even conduct the research. So it's, am I asking the right question? Am I communicating it correctly? Is the method of communication and outreach correct? So you want to include families not only just as a participant in the research, but in the whole planning, procedure, process part from the very beginning.
Yeah, that was one of those projects where when they came back to us after they had asked for the initial information, and I looked at the updated survey, I was like, holy cow, that's all the stuff that I said. Those were all the changes I said they should make. I mean, that was so empowering. And I felt like, wow, they really are listening. That was like a crucial moment for me to say, they're not just coming here and saying, we're going to ask you some questions, but we're not going to do anything with the information we get from you. They really took it to heart. And I just happened to be a survey geek, and that's what they wanted. And I'm like, oh, you don't know what you're asking for here, because I will give you information. But it was fun to do that, and then fun to see the change that came from it.
And as a result, a higher participation rate and better responses because families influenced the questions.
So I'm hearing a lot about the transparency, the engaging, the building rapport, making sure there's value. Can we talk a little bit about compensation directly? Because that's another way that we can demonstrate that we value people's experiences. So who wants to talk through this sometimes delicate but very important topic of compensation?
I'll start out because this is like my passion right now. When I first went to a meeting back in 2019, after the meeting, they said they wanted to give me a gift card, and I was like over the moon. I was like, you're going to give me a gift card just because I sat here and shared some information? Wow. But it's gone from that to feeling like, no, I have a right to have compensation. This is what I used to do for a living. I used to do surveys for a living, and I used to do documents and metrics. And now I'm getting to share that background, but from my own personal experience. And compensation is just a very loaded thing right now because of I always like to say compensation without penalty, because it can affect our benefits, it can affect our taxes. We have people that don't accept compensation because they're afraid of the hit they'll take. And that's just wrong, because they are still doing the work and they're valued members, people that have a very unique perspective. And I'm part of the group that Chelsea is with, that we're looking at compensation for families legislation. And it's big, it's huge, because it's not just a state thing, it's a federal thing also, because it affects a lot of different programs and affects taxes. And so I want to be in there. I want to be that person who is like, I'm the one that's getting the compensation. Can I please have a say in what's going to happen here? And I'm so grateful that I have that opportunity to do that. But we should be compensated, but we should be compensated without penalty.
Yeah.
Yes.
Go
ahead, Melissa. Okay.
I would say we are still trying to work on this issue. We understand it's an important value, and I think we've definitely been trying to encourage that more in our various, grant funding streams and announcements. Just to share, there's actually a current announcement out for the preschool development grants birth to 5. competitions, and it does speak to making sure that there's some family voice and engagement in the planning and implementation. So we're hoping by signaling that in the grants that it allows, the states to be able to do it. At the federal level, we have a little bit more of some of those challenges, but I do know we try to leverage our technical assistance centers and research firms, and then also we've been really fortunate to try to partner with philanthropic organizations who can provide support for some of those compensations for some of our meetings and, participants in some of our advisory groups. So we're still, it's a really, really important issue. And we're really actually looking forward to learning from how states are doing it and hearing from states about what they need from the federal government in terms of guidance to allow those things. So.
Yeah, this can be a sensitive issue. And, I'll just speak on the research end of it because I think, when we're thinking about compensation, oftentimes, we're thinking about, well, if we're doing a focus group or an interview or a survey, right, we're going to compensate somebody with a gift card. And, they're still providing you with some information on lived experience, assuming that's who you're interviewing. But there's a very clear boundary there, versus if you're working with someone as a consultant, how much would you pay a consultant? And look, I'll be honest, there's a lot of other things I can do. Like I do photography on the side, but I know that's not what's giving me my salary, right? There are a certain set of skills that I am applying to the work that I'm getting paid for. If you are engaging people with lived experience as consultants, given their experience with X, I don't think we should be shortchanging them. That's sort of been my position. And yeah, we have, again, we're working with consultants as part of this project I was talking about, and they're all getting cut the same check for the same time and for doing the same kind of work. They're reviewing materials and they're coming in and they're participating and they're getting paid accordingly. Because they're not research subjects, they are consultants. And so I think for researchers in particular, we have to be aware of what we're paying for, and what we're asking for people and compensate them accordingly. That's my position, and I'm sure there's a lot to learn about this.
I think that's so important, right? That yes, they are compensated equitably, just as consultants would be. The issue that we're facing, I think, too, is that for people who are currently, on some of our public benefits, additional compensation, even $100, $25 extra a month, could kick them off of their benefits. So what we're trying to do is, one, in Colorado, first, just allow some of our board and commission with folks with lived experience who are sitting on these boards with other people who are compensated to be there. Why shouldn't they? Right. So in some of our statutes, it's actually compensation is prohibited. So first, removing that, allowing us to compensate if we can, and then secondly, making sure that compensation doesn't negatively impact their eligibility for certain benefits. And so we were able to write a memo in the state of Colorado that our counties could use that educates our county workers and how to input this extra compensation, not as earned income, but as something else. And then I think a big part of this is just the knowledge sharing with the families that you'll be working with. Like, hey, here's how we determined our rate. That's one thing for the feds. Rate determination and impact income disregard, I would say, are the two main things that we would ask the feds for help with. But then having that conversation, so Samantha and I, Samantha, I want to compensate you. Here's how we set our rates. Here's how we pay. I just want to make sure that you're aware, if you make over $600 a year, you are going to get a 1099 at the end of the year. You're going to have to report that on your taxes, and potentially it could impact your benefits. But luckily, we just finished that memo last week. So hopefully there won't be those issues anymore, determining program by program. Some programs say any compensation's okay. Some programs say only gift cards. So we're having that battle back and forth right now.
Yeah, and just building on what everyone has already said, and especially what Melissa was saying from the federal perspective, that's definitely something that our office has been thinking a lot about as well. I think one area of pushback that we've heard in the past is well, if we're paying people to join this meeting or to participate or help us with this research study, that, it's not fair, or it might bias people's input that they give us. And I think we're trying to push back on that by saying it's actually the opposite is true. It's actually extremely inequitable, as folks have already touched on. If we're not paying people for their expertise and we're only paying other federal staff members, or we're paying our grantees, but we're not paying people who have the on the ground experience with exactly the information that we need to help improve our programs, that's actually very inequitable, and it's going to really influence the people who can join meetings or participate in advisory boards or consult with us, because then we're only getting perspectives from people who can do so without receiving compensation. And so I think that's been helpful, and we have really supportive leadership who are trying to help us, think creatively and work with our general counsel and take a look at our statutes. What are the statutes that dictate whether or not we can compensate people depending on what program office folks are in. So those are definitely conversations that we're having at the federal level, and I'm just really grateful to folks with lived experience for pushing us. Shouldn't have to be the case, but I think at least from our office, folks with lived experience have really pushed us to say it's really harmful and detrimental if you're not paying us for our expertise. So I think that's something that jumps out from my office's work.
I'm seeing in the chat that there's some real interest in hearing some dollar amounts. Does anyone feel comfortable talking about a minimum rate or a range, or where they get the numbers and their calculations?
Sure, I can start. It's hard to keep up with the Fed sometimes, but at the state, we have taken a look at what independent sector puts out for a volunteer hour, similar to a match or in kind that you would put on a grant. And then secondly, the living wage for a higher, like Denver County, for example, in Colorado, the living wage for a single parent and 2 children living in Denver Metro, and kind of figuring out between those two numbers where we're going to land. Right now, we're at $30 an hour, which is actually probably lower than the living wage at the moment. But that is where we've landed right now.
And then I can speak to the Office of the Assistant Secretary for Planning and Evaluation, ASPE, where I am, and HHS. For a couple, I just am thinking of examples from a couple of recent projects. It definitely varies. I think, as folks have already touched on, I think it's really important to think about what level of expertise, what level of engagement are we asking for someone. I think you have to think differently about attending a 1-hour meeting versus asking someone to consult with you on a recurring basis. The level of detailed information that the level of effort that you're asking for. So those are a bunch of caveats, but I think on recent projects, we've been compensating folks for some like ongoing advisory or consultant work at a rate of $50 per hour. And I think, I'm just throwing that dollar amount out there. That is definitely not the standard. I think as Bright touched on earlier, it's important to think about what are we paying other folks who have expertise? What are we paying other professionals for this work? Because, people with lived experience have expertise in the same way that someone we would traditionally think of as a researcher or a professional consultant has expertise. So that's, how we're thinking about it.
Yeah, and I would echo, it definitely varies, but the other kind of compensation consideration is childcare and transportation and other supports that may be needed to really participate in the meetings. And I do think it would have to vary depending on the nature of the engagement, kind of one shot versus longer advisory. That's definitely what I've been hearing too. And we have been hearing the concerns about the impact of that on pushing people and impacting benefits. Washington State passed some legislation, I think last year, specific to this, and there's some language in their legislation that they're asking the state agencies not to consider the compensation, to harm sort of benefits eligibility. I'm trying to find the link to that language, but I know they're working through some of that guidance actually in the state right now.
Yeah, I think it's for me, it's very much dependent on the funder. For our expert work group right now, we're paying folks for each meeting they attend. The meetings can last between 90 minutes and 2 hours. They get $150 for that time. But there were other projects I've worked on, if we're collecting data for a focus group or even an interview, it can range, sometimes $100, sometimes $50. But, we worked with our federal partners to get to some of the numbers that we talked about. I think it's just being able to, look, if you need to have a little, if you need to have some time to really make your point, like, make it. Like, if you think folks are deserving and of more compensation, and that I don't know if you've noticed how bad gas prices have gotten. I realized that just buying a Subway sandwich, like, I have to like think about that decision now. Things are a little different. And so where, a $30 gift card was cool, in 2020, it's just not the same anymore. And so sometimes folks need to have these honest conversations about the folks that are controlling their dollars. And I've had to do that as well. But $150 per meeting is how we worked it for Reframe. But I think it varies.
So I'm interested in making sure that we go back to a topic that we touched on when we were organizing for the panel today, and we've mentioned it a little bit, but it's the issues of equity and power. So I'm wondering if we can talk a little bit more about specific ways that we share power, and so that people with lived experience and those who are trying to solicit the lived experience, we reduce some of the inequalities, the inequities, and can folks share some of their thoughts about that?
Yeah, I'll start. The very first meeting I went to, there was a way that they set the playing field to be level for us. We all sat around one table. We didn't actually know whether there were workers or not. There were no name tags. And I was like talking to somebody next to me, not realizing that they actually worked for the state. And that was actually a good thing, because I didn't feel intimidated at all. So setting that level playing field of, we're all the same, we all have the same to offer. I'm not more important than you because I happen to work for the state or this research company or whatever. That was really important to me, because I went in there so timid, like, oh my gosh, I have nothing to offer, to coming out of that very first meeting thinking, wow, I felt empowered. I felt like I do have something to offer. And that is what kept me coming back, is that I wasn't looked down on, like, well, this is the person that has this, public benefit. There was never anything like that. That was really important for me. And then, of course, the feeling safe and knowing that it was an environment where I could share my story, and I wasn't going to be singled out as being, complaining, or it's like we were just sharing the way things really were. But knowing that, I didn't know who everybody was in there. I didn't have to fear anybody, because, everybody was just the same in that meeting. That was really important.
And I can share for myself, I know that having been part of the parent federal think tank for, wow, I think it's going to be 2 years. Time has flown. So, but the fact that we were able to, when I first came in, we were still kind of getting everything a little bit situated. It was running and everything. But what we were doing is we were having pre-meetings. It was some of us as parent leaders with our federal partners, and having that sit down to develop what it would look like, these meetings, and organizing them goal-oriented. And also we came up with how we would partner in co-facilitating the meetings. So so one of the things that we took upon ourselves is to help co-facilitate these meetings that we do have monthly. So it wasn't putting all the pressure on our federal partners and putting them out there to do everything. But the fact that we were given that opportunity to say, yeah, you know what, this is a wonderful idea, and began to do that, really changed the whole function of our meetings. We were there to discuss things, but the comfort level, it really did change. And so we continue to invite other parents, throughout the nation to participate in this. And so, I mean, when we're able to have these meetings on the side, there's such a comfort. We've built such a relationship that when there was something that we felt didn't go right in a meeting, or we felt that, well, there wasn't enough of this, or whatever it was, we were comfortable enough to approach as parents to our federal partners and have that sit down, knowing that we weren't going to be judged or looked down on, or that we weren't going to be, or anything wasn't going to be ripped from us, but that we were going to be able to come and have these conversations. Sometimes they were serious conversations, and then we left there empowered. But we were very inclusive of our federal partners to be able to do that. And so I think that that's something that I saw, and the diversity in there of the openness and allowing anyone. There was no questioning of credentials or, do you have this? How long have you been this? It was more of the opportunity, and even now that we promote out there, if you're a parent that's visiting and you would like to go further, we're not asking for too much of you, but just for the opportunity for you to join the meeting, see how it is, and be a part of it. So that way the co-facilitation happens between our federal partners as well as our parents. And it's been working out very well, very well. Wonderful conversations. We've had leadership come and, speak to us and share things. And as parents, we've been given the opportunity and the space, the safe space, to be able to ask questions in return and have a conversation the way that it should be. And so that's one of the things that I saw on the equitable piece on like with the parent federal think tank. But even with I'm sorry, Laura, I keep forgetting
The equity technical assistance.
There you go, equity technical assistance, co-facilitating those as well. And so I saw that very beneficial. The conversations were wonderful. And it was just this leaving of completion, of walking away from something and knowing, hey, I had a voice in it, and so did our federal partners, and we have a relationship walking away to where we can come back and be comfortable enough to say, hey, this is what was working well and this wasn't working well. And I think that's important, especially when you're being inclusive of individuals with lived experience, that they know that they're being heard and that they're being included. And that they know that something is happening, because we don't want to be there just a box to be checked. We don't want to be there to say, you know what, let's hear you out, but let's just move on. We want to know that something is happening. And so the two main, works that I've been able to be a part of have really proven that. And for me, that's equity. That's equity right there. That's equality across the board. And so.
In Family Voice Council, we are given the opportunity monthly at our meetings to co-chair. And I had been with the Family Voice Council for, I think, 3 months. And I was like, I'll do that, because I thought I'll get like a behind the scenes look at how this meeting is put together. What I didn't realize was the impact it would have on feeling so engaged after that. I really felt like I was a part of the Family Voice Council because I had a little bit more say in like, oh, we're going to look at these presenters. Well, how do we want these presenters to talk to us? And then from there, I actually brought that to another group that I'm in, our local Medicaid Ray. And I had been telling them about that. And next thing I knew, they're like, we're going to do co-chairs for our meetings too. And they're like, we'd like you to be the co-chair for the entire year. And I was like, wow, I'm like, that's cool. I like that. I get to help with like setting things up and, how I, what topics are important to me. So that's a big thing is, being asked to co-chair the meeting. It's immediate buy-in when there is something like that available.
That really seems to connect to a comment that was made in the chat from a researcher who has lived experience and works with people to train them to be researchers. So it's not just as advisors or informants, but there's an element of buy-in and not to put words in the person's mouth, but maybe skill development or opportunity. Offering an opportunity is probably a better way of saying that. So it's exciting to see that it can happen in the research setting as well as was pointed out. So I just wanted to pull that into the discussion. Are there any other thoughts about sharing power and promoting equity?
I think I would just add, and I think Roger and Samantha have really hit on this really well, but I think at least from the federal perspective, we're really trying to think about how, there are certain decisions that we have the authority to make ourselves. There are some that we don't. And so just trying to be really transparent about that upfront when we're coming into an engagement and saying, this is what we can change. This is what will take, statutes or legislation to change. And really, as much as possible within the authority that we do have, just trying to share that decision-making power. And again, just be really honest about that up front has been, I think, really helpful for us. And it's also become really clear, I think, through some of our work that you can't like convene a group or start off an engagement and then think about equity, once you have it up and running. It's really thinking from the very beginning about that and working with the people with lived experience who you're working with to say like, okay, what are some group norms that are gonna guide our interactions? What are some ways that we're gonna interact with each other that are gonna make this a better experience for all of us? So I think those are some things that come to mind from our experience.
So you mentioned just sort of some of the things that can come out of the discussions, out of these engagement discussions around these big policy changes that we hear and we know, oh man, I don't think we can, I think that's outside of the scope of this project. That's like a common saying, right? And I believe that certainly to a degree that's true. But one thing that I've been particularly sensitive to in hearing that, right? We've sort of had conversations with folks on the ground, sort of have conversations in these focus groups where people mention these issues that we don't think we can change in the short term. But I remember presenting that in front of a group, presenting this, this need, and somebody coming out and saying, well, yeah, we may not be able to necessarily change it in the short term, but maybe that's not necessarily what they were asking for. Maybe we need to think about how we empower folks to engage in the political process that they don't feel they have control over. So does that mean we need to build knowledge about how to engage local legislators? Does that mean there are more partnerships that agencies need, more political action partnerships that agencies need, or some kind of mentorship programs that teach clients and program recipients about how they can engage and change local policy, right? So even if we sort of feel like we're in a position where we can't make these large changes that people are talking about or mentioning, how else might we interpret some of the needs they're talking about around this area? And so when it comes to equitable evaluation, a big part of it is bringing people in with lived experience to really interpret some of the things we're hearing, because I've been humbled and surprised at times. And so I know there are a lot of questions in the chat about research, so I'm just going to sort of throw these little nuggets in there when I can. Thank you.
No, I love that, Bright. I love the fact that you're able, because one of the things that I share is that to be able to be transparent and upfront is something huge for an individual lived experience. We want to see the big picture change. We want to see that we're influencing on it, but that doesn't mean that it always has to be something huge. It could be the little steps that get there, but just knowing that and being upfront and sharing, look, this may take some years. I want to be upfront with you. We're working on this, and you may get some pushback. Well, oh, that everything takes years and right? But you'll get that. You know what? It's better than nothing. And being transparent with that really goes a long way, because what it does, it makes that individual across from you feel like they're special enough for you to take the time to explain to them that these processes don't just happen overnight, rather than, well, we're just here and it's just going to be what it is, and leaving somebody guessing. I mean, that's just for anybody, but in general, for an individual lived experience who's willing to come back and to share, whatever the subject is, there's a reason behind it, and that's change. They want to be able to be inclusive, to know that change is coming. Now, how that happens, of course, sometimes it's out of our hands, right? But the fact that we're able to be transparent enough or take the time enough to explain how things function. This is why, like with our parent federal think tank, one of the things that we encourage our federal partners is to bring something new to us each meeting. Share with us the things that are happening, share the things that can't and cannot be done. And so, being able to have that actually builds that ability to have a guideline. I'm very goal oriented, right? So I'm like, okay, so what's this? Where are we going? What is it about? What is it that we're aiming to do, right? So that's me personally. And so being able to put that down, but giving the opportunity to the partnership, right? Federal partners to be able to come to bring in, this update and report, but also to be upfront with us. If there's something that cannot be done, please let us know. And the reason why is so that way we feel important enough that we're being told and someone's taking the time to say, hey, your voice is important and we want to collaborate and we want to partner. So we want to be upfront with you. We want to treat you as an equal and let you know out of respect, this is not going to happen overnight, or we can't go beyond these guidelines. We can't go beyond this right here, which helps the group know, okay, well, I'm important enough for you to take the time to explain to me what it is that can and cannot be done, or if there's going to be timing. And as we've asked as well, is there any way that we can get some type of feedback on what's already been done, even if it's something small, letting us know that things are happening. I know Samantha shared that, right? The importance of seeing something and seeing a piece of paper and say, wow, that's my saying. I felt the same way as well when I was, given certain things with different agencies. The fact that I was able to see that something was written down and that something was happening was huge. It was huge. It may not seem like it. And yes, we want change, but when we start to do this type of work and we see that our lived experience is actually helping out, not just us, but helping those who are coming, other individuals, other families, that's huge for us. And so, that's huge to be able to do that, to take the time to explain and show the importance of that individual or those individuals who are right there, who are expecting things to be honest. And you may not get the result like, oh, well, yeah, you know what, this should be faster. But the fact that when it sets in and knowing that we're slowly but surely going to be a part of something, that's what it's about.
I think I've been really fortunate because I never thought I'd be involved in like the legislative type stuff. I just thought it would be boring to me. But when I went into this and was told, we're not making policy changes here. We can only do so much. And then my next question was, well, how do we then do that? And we have, I'm fortunate with Chelsea, like she will come alongside of us and say, here's what we can do with legislation. We'll help you prep to talk to legislators. We'll tell you what the legislation is all about or how the process works. I never saw that as being a part of this because I didn't think, I could ever really go that far, cross that bridge. And now I have. And it's amazing because it's like, okay, there are things that need to be changed. It will take legislation. We can do that. And it's just that simple. But that door had to be opened. And now that it's opened and you can walk through, but not be afraid because you're not doing it alone. And I think that's really important, but there's no barrier to, well, we don't make the changes here. It's like, okay, well, then I want to go to where they do make the changes.
I love that. And I think this is great because the discussion is kind of getting at now what I keep seeing in the chat too, of like, how can we structure engagements so that they are beneficial, not just to, agencies or researchers, but how do we make sure that they're truly beneficial for people with lived experience who we're engaging? And I know folks are already touching on that, but I'm just curious, are there other kind of tips that folks would call out for how to make sure from the outset and how to plan so that an engagement can be beneficial for people with lived experience?
Yeah, that's something I always strive for. Mutually beneficial relationships. It's got to be a two-way street, right? Families know when they enter the room, if it's not for them, they can easily walk away. So from the very beginning, we want to make sure that it is a two-way street by offering, examples like Samantha shared, like how do you testify? How do you share, how do you come up with a bio or an elevator pitch, when you meet, that person in the elevator, the legislator. Other things, if whatever families are interested building, whether professional or personal skill building, they can mention that every month. We have a survey that goes out after the meetings that touches on what other presentations would you like to hear, right? So also two-way street. Someone else said, how do you set your agendas? Yes, I have a lot of colleagues who are outreaching me. Can we get on the agenda? Can we get on the agenda? But I also make sure that I'm hearing from families on what they want to hear too. So it's a little bit of a balance there. But just making sure that we're providing those skills needed or requested, and we're providing presentations and making change and communicating it, closing the follow-up loop, right? So not only do we have a survey for members after each month, we have a survey for our presenters after each month that says, what did you learn? Did it change your thinking? What actions do you plan to take? And then when would you like follow-up? So then it's automatically, if they say 60 days, automatically an email gets generated to them 60 days later that says, how are you doing with those action items? Have you implemented them? Are they still in process? Give us a status of those actions, and then what else is needed. So at the end of the day, I can pull up our report, our dashboard that shows how many actions have been implemented based on family voice impact and input and feedback. So that's the one way I think evaluating and sharing results is huge.
I love all that, Chelsea. I'm actually really jealous that you built. We need to build in that sort of follow up a little bit more consistently. I think what Roger was mentioning, we've been trying to do, obviously, like do the planning before, and I know other colleagues at ACF, even with listening sessions, kind of one time only meetings, they've set up planning meetings with the parents to really have them understand the context and who's going to be there. But I think really building in that follow-up is something that is also really important, the follow-up and debriefing. And I know there was a question that came up around, issues of trauma coming up, because I would say, Roger, our last meeting, we were talking about behavioral health emergency response issues. One of the parents actually had a shooting, in her neighborhood, like literally just heard about that. So we had to do some really giving time and space. And I would say we probably need to we were even thinking we need to probably give even more time and space for that next time, and identifying, professionals that might be available in case something gets stirred up. So I do think those considerations are probably really important too. So.
Yes, depending on what it is, when you're talking about something that with someone with lived experience who may have gone through traumatic situations, you want to be very mindful of that and step very careful to the point where you're allowing them to share what they feel comfortable with sharing. Never, put them in a corner to make them feel like they have to, because re-traumatizing someone is not good, right? The triggers, and you're gonna, you can get a backlash that can come, south, especially when dealing with child welfare. Myself, that's one of the navigations, child support, family law. Dealing with families, dealing with kiddos, right? Those are what we call our priceless treasures. And so those are the ones that we really want to be careful with. And just like as Melissa was sharing, something to happen within your community and know something is huge, being able to know when to keep the agenda and when to back off. When it's a time to create a safe space to have that conversation, but also to have that opportunity for check-in with the individual, because we don't know what they can be coming in with. Life can hit, right? Family members, something can happen, situations, circumstances. So I think that when you're dealing, and this is for everybody, right? Even if you're part of a federal agency, you can come in with life happen. You can come in with situations, a loss of someone, some type of traumatic moment. And so those are the type of things that I think that, really when you're going in to the community, you want to be mindful of. You want to know what's been happening. You can be going in for research on one thing and then have something totally different pop out. And so being able to see that and being able to be, to the best of your ability, sensitive to it, and knowing when it's okay to proceed and knowing when it's not okay, and to find, the help that's needed to be able to provide for that certain situation, because it can trigger more than one individual, right? When we're talking about people with lived experience, we don't know how much lived experience they have. They could be coming in for something that, that's one subject, and then, but they've had lived experience with others. Like I shared with myself, child welfare, right? Child support, family law. So those are some of the navigations that I've done. But that doesn't mean someone from behavioral health who has child welfare, can be triggered from something that has taken place. And so those are the type of things that we also want to be mindful with, especially with the way that we're asking questions, how we're approaching, to be respectful in such a way. And if they don't feel comfortable, right, because sometimes they can come in, and as Samantha shared this as well, the uncomfort level that's there can come out differently from everyone. So just being mindful of that when whomever that we're dealing with, to make sure to the best of our ability that we know what we can and cannot do, and knowing when to back away, and knowing when you can go forward. There's some things that I would throw out there, because like I said, we can be given a resource and think that we're communicating with someone about that resource, not knowing that they have other lived experience behind that can trigger within a conversation, or maybe something that has just taken place. It's something to keep in mind.
That other life experience and that awareness brings me to a question that I wanted to ask, and then was also mentioned in the chat, about having staff who are providing services, who also have experiences like caseworkers. And so maybe for our last question before we move to the closing, can we talk a little bit about how you incorporate staff with lived experiences?
So I think when you bring in staff, you also have to be mindful and have a conversation with the staff. Once again, depending on the lived experience that you're working with, right? No disrespect, but working with child welfare, you see the good, the bad, and the ugly. And sometimes and this is just being real, there's some where you're just like, are you really, really working here? Right. And sometimes it's not intentional. It can be burnout. It can be, other situations. Once again, they can be going through life. And sometimes, or someone just don't know any better. And the questions can come off in such a way that a parent or someone with lived experience is offended. And so what do you do with that? How do you approach that? Of course, we're not going to be able to prepare for every single thing, but being able to really evaluate your staff that's going to be involved. Or there are some who are not sensitive. I really hit on a lot of like bias that really plays a part. And then we're talking also about, when we talk about like fatherhood, right? I've had one where it was a male social worker who was looking at a gentleman and wondering why he's crying. And so as a father with lived experience, I had to remind him, and ask him if he had kids and what he would be doing if his children were removed. So it really took him to a different perspective and really changed his mindsets. And so the whole approach changed on that. And I think that having that conversation, especially with who the audience is going to be, who the individuals with lived experiences are, the more traumatic the individuals that we're looking at, the more of a conversation, and also the awareness of, what we have to be mindful of these individuals that we're having. Also, how deep we're going in. So what I mean by that is that if we're going into the community where there are individuals who have not had a conversation or really an encounter with individuals from a federal agency, then knowing that a response can come raw and uncut, right? You ask a question, you tell them to be real, it can come back. And the last thing you want is for any of your staff to be offended and begin a back and forth type of thing that triggers just this whole chaos. The other thing I would say is also to the best of your ability, trying to be strategic in what it is that you're doing and how you're approaching it, right? Because going in there and saying, to a bunch of parents, just an example, tell me what the issues are. And you got 50 parents yelling at you. How do you facilitate that? And that's kind of one of the things that we were dealing with. Okay, so as a parent partner or a parent with lived experience, let's have the conversation with other parents to say, okay, so we're going to facilitate this in a way to where we're going to be respectful and try to get as many questions, but at the same time, give the opportunity for answers. Facilitation is vital, especially when you're dealing with the community. So I'll stop there.
Yeah, also in regards, I think, to incorporating people with lived experience, I think we all have lived experience. It's just, it depends on kind of what area we're talking about. So specifically, we at Human Services try to say, you know, lived human services experience, any of the programs that fall under the Human Services umbrella in Colorado. And we're doing a conscious effort. I'm a co-chair of our Equity, Diversity, and Inclusion subcommittee. And one of the major projects was embedding lived experience in the hiring process. So how can we make sure that I don't know if it's extra credit or what have you, but just making sure that if people have lived experience and it shows up on their application, that we make sure that we are providing opportunities for interviewing and moving them forward. Also, right now I'm creating 2 part-time family advisor positions, which hopefully will be people from the Family Voice Council who will be part-time employees at the state in the next couple of months, because that's what I heard families wanted. They wanted part-time positions, job sharing opportunities. So that's kind of the direction that we're headed based on their feedback. And then lastly, something else that we've incorporated for staff at CDHS with lived experience is called the Belonging Project. So it's a project for staff, created by staff, that, and there's topics every single month, and it's usually editorials that staff write and contribute to the conversation. And it's usually people with lived experience talking about a certain topic that falls within human services, but it's the staff members sharing their experience or identity with all of 5,000 plus at CDHS, and that goes out to all of our staff. So it's a belonging project. It's an equity, diversity, and inclusion project that we've currently receiving great feedback on.
I'm actually going to be sharing my story with the Belonging Project. They're asking people with lived experience to now share with CDHS. And one of the things that I really liked is, and I'm sharing a story on my experience with domestic abuse. So it's not an easy topic, but they made sure that if I had any issues along the way writing my story, that there would be someone that I could talk to, and already setting up after the story is shared, having a debrief to make sure that I'm okay with, you know, the way that it came out. And it is kind of amazing for me to think, wow, my story is going to be shared with these people so that they can see that, again, I'm not just a statistic. I'm not just someone who uses the program. I have a real life. I have real experiences. And I'm trying to take those experiences, good or bad, and use them to help myself and to help other people. So I'm very proud to be a part of the Belonging Project, and grateful that they have, you know, let me share my story there.
So we are quickly running out of time. There's so much more to talk about, but hopefully this was a good place to start the conversation, and that we've given enough information and ideas to stimulate more conversations. And hopefully this is just the beginning. But before we close, and Laura gives our closing remarks, we want to give our panelists with lived experience and programs an opportunity to share any reflections on we've talked about today, or any closing thoughts.
So I would like to say thank you. Thank you for giving us such a platform, you know, to be able to share, you know, the things that we're doing, the things that are happening, the things that are concerning, you know, and being able to come and, you know, feel comfortable enough to be able to feel inclusive on everything. With all the programs that are happening, for myself, I can speak personally that I am, you know, overwhelmed with joy that we have an audience with what I call our federal partners. And so I just would like to thank everyone for your time. I know I can talk and talk and talk, and I apologize for that. But at the same time, you know, I'm just really humbled to have the opportunity to be here and to be allowed to speak, you know, on my lived experience, but also the lived experience of many other individuals that I get to work with and help every day, you know, and help push forward, and including those from different coalitions within the state and also national and federal partners to be able to make change happen like I know we all want to. So thank you so much for your time.
I'd also like to say thank you. I know that I am a better person because I get to share my experience and that something good comes of that. There have been a lot of difficult things in my life, and knowing that those things can help someone else makes it worthwhile for me. So it's really important for me to be able to share this information. My life is the best it has ever been, and I don't think I would have thought that 3 or 4 years ago. And it's because am able to do this work, because I'm able to share my story. So I'm really grateful that you have allowed us this opportunity to speak and to have other people hear us. So thank you very much.
Well, thank you, Roger and Samantha. I just want to close out with a few quick reflections as we're kind of coming to the end of our time together. And I'm just so grateful for this conversation with you all. I know I've learned a lot. And I would encourage folks to go ahead and start thinking about how you can implement this in your work. All the attendees who are here with us today, you know, if there's anything that you would feel comfortable throwing in the chat about, you know, ways that you might start thinking about how to engage people with lived experience if you haven't done so before, or ways that you can, you know, deepen the work that you're already doing, whether that's something you want to share publicly or just reflect on, you know, coming out of this webinar. I would encourage us to all continue to think about the ways we can, you know, improve our work by better engaging people with lived experience. And I just want to call out a few themes that kind of stood out to me from the conversation today. I think, you know, one thing was equitable compensation was obviously a hot topic, I think, in the chat. So I think that really stands out, you know, making sure that we're all continuing to make sure that we have ways to pay people for their expertise. I think it also stood out to me. I think this discussion about, you know, staff with lived experience was really helpful at the end, thinking about how we can work with people who are maybe already in our agencies and continue hiring on people with lived experience. I think that was really helpful. And just some of the themes about accountability and transparency, you know, making sure that we're doing this work in a way that's really connecting with people who are most impacted by our systems. I think those are kind of some of the things that stood out to me from our conversation. I was just really encouraged by how practical some of the questions were in the chat too. I love that. I think sometimes these kind of conversations can be really high level and theoretical, which is great. But I think the fact that people had, you know, really concrete questions like, how do we think about institutional review boards and what are the rates that we need to pay people, really encourages me because it makes it clear, you know, that people are really taking this seriously. And so I just wanted to close with a few notes about this really is such a priority for HHS as well. I think hopefully folks will be encouraged to hear that. I can speak certainly for I know the department as a whole is really prioritizing this. I'm not in the administration for children and families, but Melissa is, and I know this is a big priority for ACF. For example, they issued a strategic plan earlier this year. And one of the strategic plan goals was to advance equity by reducing structural barriers, including racism and other forms of discrimination. And a part of that goal was really to make sure that ACF is centering and integrating perspectives and experiences of program participants in everything that ACF does. And then coming from my perspective in the Office of the Secretary and ASBE, you know, this is something we've really been thinking about through our Equity Technical Assistance Center that Roger mentioned earlier. We were really grateful to be able to work with Roger and a number of other experts with lived experience to provide technical assistance to HHS staff on how we can advance equity in our research, our programming, our policymaking. And a big piece of that was thinking about how to engage people with lived experience. We were grateful to have a peer learning community, like Roger mentioned, focused on how to engage people with lived experience and have a number of tools for HHS staff coming out about how to do this better. And we're hoping to make some of those, while they're tailored to HHS staff, we're hoping to make some of those public, hopefully sometime soon. So just those are a few examples that this really is a priority for HHS, and clearly from all of you, it's a priority in the states, from the research community, and from all of you here today. So just really grateful to Jordan Engel and Lauren Antello from NAWRS, everyone at NAWRS for making this webinar and this conversation possible. Thank you so much, Lisa, for facilitating this great conversation today. to Chelsea, to Roger, to Samantha, Melissa, thank you, and to Bright, thank you all so much for being part of this conversation. And thanks to everyone for spending your afternoon with us today. So I'm just really grateful for this conversation and to learn from all of you. And with that, I think we can close it out. So thank you everyone so much.
Thank you.
Thanks.